ECRMC has been the topic of much controversy within the last few years, and this time around, this past year, they had their first profitable year in about 5 years. And here to talk to us a little bit more about uh, what they have done differently today is Dr. Velez, the CEO of ECRMC. Dr. Velez, thank you so much for being here.
Thank you for having us. Just a couple of things. I just want to thank our staff because they have done a great job in terms of stabilizing the financials of the hospital. There are multifactorial things that we have done over the year that has helped stabilize our financial outlook for the medical center. We have been looking at uh, staffing. We have been looking at the contracts. We have been looking at maximizing our reimbursement, negotiating new contracts, looking at right sizing the organization. One of the things that happened, and COVID had a huge impact on every financial situation of different hospitals throughout the country, is that we needed to hire what we call traveling staff to help with managing the COVID influx of patients into the hospital. So we were spending about $2 million a month on additional staff, which was required to take care safely for the patient population that we had in the medical center. However, you know, now that COVID hopefully is behind us, we wanted to ensure that we had our own enough staff to take care of the population. So we got rid of some of the traveling folks that we had here in the medical center. So that helped financially a lot. We have also looked at purchasing of supplies and medication. As you know, with COVID, there were a lot of dollars spent in the antiviral medications for the COVID disease process. So we have stabilized that. So there are multiple things that we have looked at and stabilized. This is the first year in the 5 years that we have a positive outlook for the medical center. We finished this year at a $2.5 million in the black. So very proud of all the work that has been done with our staff, our physicians, and looking forward to a better financial outlook for the medical center.
Dr. Velez, could you explain what is the notion of tax supported hospitals in Imperial County?
So we don't know when we merge all these healthcare systems together how much more money the taxpayers are going to have to pay, if they have to pay anything at all. Uh, we were involved in doing a financial analysis with a group that's called a Kaufman Hall Group. And combination with UCSD, we looked at our ability to sustain and mitigate losses. But in order to get a better handle in terms of what the new healthcare district needs, we're going to have to get some information from the other facility so that we have a better assessment and complete assessment of if there's any type of tax that will be needed for this new healthcare district. I think, in my opinion, I don't think there is any additional taxes. I think that looking at services, consolidating services, and creating new programs to ensure that we capture more of the patients that are leaving the area to get care in either San Diego or Palm Springs or Yuma could stay in this community.
How has the $28 million zero interest loan from the state of California helped ERMC?
So there are a couple of things. When we got the funding from the state, there were specific things that you could use the fundings for. We have used the fundings for several things. The first thing that we used the money for was to finish some of the construction that we have been underway for in terms of complying with the new earthquake regulation. So we had an earlier deadline. So a lot of the money has been and will be used to finish our compliance with the earthquake regulation. The other component that we are using the dollars from our medical center does not have a unique medical electronic medical charting system. So we're using some of those dollars for that. We are using some of the dollars to do some renovations in other areas. And we have used some of the dollars to finish this ancillary service building where we just opened a new pharmacy area with the latest technology for compounding medications in the area. We opened a new kitchen. We opened a new sterile processing area, a new receiving area, and that was in advance of complying with the new regulations for earthquake. So a lot of those dollars are being used for that.
How much debt does ERMC currently have?
So and that has been talked a lot about. We had some bonds that were issued back in 2018 to start the construction and compliance with the seismic earthquake regulation. So there's $123 million in bonds, and then the $28 million in loan that we got from the state that we'll be paying back. So we have been paying off on that debt, and we'll continue to pay off on that debt. So as of now, we're self-sustained.
There is evidence of a revival at ECRMC, said Olivas in Thomas Olivas in a recent press release. Is this claim mere rhetoric or something of substance?
No, I think if you look at our financial close of the end of year for 2023, 24, you could see that our financials, we've been trying to be very transparent about our financials, and we ended up the year at $2.3 million positive. So I think the infrastructure that we have put in place is going to continue, and we will continue to look at opportunities for improvement and creating new programs for the medical center so that we continue to be financially sustainable.
What do you make of the healthcare consolidation trend, and what does it mean for patients, providers, and payers?
So for me, when I hear consolidation, I think I hear a good thing for the Imperial Valley healthcare community. It is the ability to bring everybody together to the table to ensure that the resources that we have, the limited resources that we have in this area, are used appropriately to create new programs to ensure that we have the staff, the physicians, the supplies to keep those patients here in the Imperial Valley healthcare area. So it doesn't On a monthly basis, we transfer patients out of here, out of the Imperial Valley. We either put it in a helicopter or transport by ambulance. That is not great health care for anybody. I don't care what anybody says. If you have to leave your community for a higher level of care, you are separating the patient, the providers, their family, different environment, and we are trying to look at, when we consolidate, how do we provide those services so that our patients remain here in the Imperial Valley without the need to be transported outside. So for me, consolidation is a great thing. We could look at bringing additional programs, hiring more physicians to the area, more nurse practitioners, more PAs to serve the community.
Some argue that consolidation increases cost but does not improve quality. Is that true or false?
I think it's false. I think consolidation, if we consolidate the two hospitals and the clinics, we would have a better chance of renegotiating better contracts with the payers, and ensuring that the cost of care is paid by the insurance companies, and that we maximize the the power of better contracts. So it's because you have to negotiate with one healthcare district.
Dr. Velez, thank you so much for joining us. It was a pleasure having you.
Thank you so much for having me.